As you know, there has been a debate for many, many years about gig workers, the responsibilities of the company to its contractors, whether they should be considered employees and the like. And clearly, so many of your drivers could now be considered, in many respects, frontline workers during this pandemic. And I think there's a newfound respect and appreciation across the country for all of the people that are working, whether they're working at Walmart at the checkout counter, whether they're an Uber driver, bringing people food, bringing people the necessary supplies. And I just wonder whether you think it changes the conversation in a different way, makes it actually more, I don't want to say more complicated, but potentially more complicated for a company like Uber, who may have to take on more and more responsibilities for the people that it's working with.
Well, we hope it changes the conversation. We do believe that these workers deserve protections. And we've always been a proponent of a model that creates flexible work. You can get on anytime that you want. You can earn anytime you want. If you don't want to earn, you can do something else. And I actually think in this economy where jobs and earnings are going to be at such a premium, it's all the more important to have a system like ours, which can be an entry point into earnings. Now, we've always been a proponent of flexible earnings for anyone, and I think in this environment, it's all the more important, with protections, with healthcare protections, with minimum earnings, and that is absolutely a dialogue that we want to get into. And we believe that that dialogue is going to create, and what we are standing up for is going to create a better system. It's going to be an on-ramp for work, and it's going to be work with minimum earnings protections and health protections as well.
Dara, does that mean that you'd be willing to consider a worker who spends more than 40 hours a week as an Uber driver, as an employee?
The model that we're talking about is that you can work as many hours as you want during the week. It doesn't matter if you work 20 hours a week or 40 hours a week, and you get protections based on the number of hours that you work. You know, I think this system of if you don't work 40 hours, you're not full-time. If you work 40 hours, you're full-time. And then there's this hard break between the two. That's the old world, right? It's actually, if you're putting in the hours, if you're putting in the hours, you should get minimum earnings based on the hours that you're working, and you should get health care based on the hours that you're working. And if you have a have and have nots based on a particular number of hours worked, that doesn't make sense in a technical forward world.
Well, does that mean you'd be paying for the health care benefits for those people who are working 20 hours or 40 hours or 60 hours? How would the benefits work out?
Based on, we would put, we've actually talked to folks about this. We would put monies into a fund based on how much our drivers or couriers have worked that would go to fund healthcare benefits, and they would have minimum earnings as well. These are the discussions that we want to have with government. And again, you can have the benefits. But let me ask about that. I mean,
what's the difference? What's the difference in having them called employees or having them pay this pool? Is it a much lesser amount of money that you'd be putting into a healthcare plot than you would if they were working 40 hours or something? I understand your point that it's not fair to cut it off at 20 hours, but I would also understand the point of somebody who's working 60 hours saying, I'm still not going to get what I would get if I was a full-time employee somewhere else. How does that break down?
Yeah, I think a lot of full-time employees get different healthcare coverages, so it's difficult to generalize and say it's going to be equal to X or Y. But what we're aiming for is healthcare that would be generally comparable, healthcare that works to protect you, and minimum earnings based on a number of hours worked. And what we're looking for essentially is that flexible on-ramp or off-ramp. You want to work, you get the benefits. You don't want to work, you don't.